Two ways to measure your blood pressure at home. Are they equal? So the wrist cuff,
or the arm cuff.
we're going to look into it today. Welcome to Talking with Docs. I'm Dr. Brad Wiening.
And I'm Dr. Paul Zalza. We're doing a sit-down style today. One, because we're measuring our blood pressure, and that's the best way to do it. And two, we got a kind of podcast style thing going on. We're just exploring if we're going to put some of our material in a podcast format. Let us know in the comments if you would bother listening to one of these podcasts while driving to work, the mall, or to pick up the kids.
Or if you measure your blood pressure at home with an arm cuff or a wrist cuff. So the question ultimately is, are they both accurate? Are they both reliable? And is it going to give you the information that you require when you're measuring your blood pressure at home?
Right now, we can't tell you if they're going to be accurate because we're just going to be comparing them to each other, so we can tell you if they're going to give you the same answer.
Right. But historically, what research has shown is that a wrist cuff gives a slightly elevated amount of blood pressure, likely related to the distance that your radial artery is from your heart. But what they've compensated for when you measure your wrist blood pressure, there's some specific things that you need to do that will increase the accuracy of it. And also the reasons why they think that maybe it's not as accurate because people don't follow these instructions.
So that's a mouthful.
That is a mouthful. So back in the day, we used to have a sphygmometer that would occlude the artery. Then you'd listen with a stethoscope as you slowly reduce the pressure, and then you'd hear the heart rate. Now, Dr. Heffernan, one of our guest cardiologists who did a blood pressure video a couple weeks ago, talked about how we don't really do that anymore. The reliable way to do it is with a machine that actually takes multiple measurements, averages them, gets rid of the high one to give us more accurate information, both in the office as well as at home.
Well, that's right. So that's what we have here, a couple of machines. Now, our cardiologist, Dr. Heffernan, doesn't like the wrist cuff.
Not a fan of the wrist cuff.
Not a fan.
And if you look at the governing bodies of cardiology and medicine, as far as the recommendations for home monitors, they do recommend arm cuffs.
As opposed to wrist cuff.
As opposed to the wrists.
Well, let's figure out if this wrist cuff is going to give the same answer as this arm cuff.
Okay.
Let her rip.
I actually did not have my morning coffee in an effort to try to be totally transparent, because we talked in some of our other videos about things that you need to do to get an accurate measurement. And those are, be resting, be seated, be comfortable, don't take caffeine, ideally 2 to 3 hours before your measurement, and then take it multiple times a day.
Caffeine is a vasoconstrictor, so it'll make your blood vessels get smaller.
Yeah.
And that smaller blood vessel will increase your blood pressure.
Yeah, the number one thing for a wrist cuff that you need to do differently is you need to have your arm bent and have your wrist measurement at the level of the heart, not above and not below. You want it about at the level of your heart. Okay, ready?
Yeah, let her rip.
Here we go.
Mine's just booting up. Did you get a reading yet?
I did.
So they took about the same time.
Yes.
Okay, I got a reading, and then we're going to compare.
Hey, they're accurate because they're almost exactly the same.
There you go. They work.
So mine is 113 on 72 with a heart rate of 56.
Mine's 112 over 72 with a 67. So clearly they give the same answer.
Obviously they work. No, that's not what I mean. What we're going to do now is we're going to use the same technique. And ultimately, when you're doing any type of scientific study, you want to have increased number of patients will increase the accuracy, as well as the number of measurements that you do. And that's why when your doctor tells you to measure your own blood pressure at home, you're actually measuring it multiple times a day, ideally at the same time of day. So say you pick 2 or 3 times a day, same time of day over multiple days. And then the more data points that you have, this increases the accuracy and removes the role of a really aberrant value. So say you had a blood pressure of like 200. Well, if you have 20 or 30 or 40 blood pressures, that 200 gets averaged down to a more normal value.
Yeah. This is not a rigorous scientific study.
It is not.
Our N, which is the number of participants, is 2.
Yes.
You'd want that to be a lot higher.
Yes.
It's not blinded because we know which one we're using.
Right.
But it's fun.
Yeah, remember, wrist cuff at the heart. Okay.
Up to the heart, right?
Yeah, here we go. You're not supposed to talk during the test.
You just did.
Oh, wow.
Yours is way off.
Mine went way up that time. So this goes to show the issues with things like this. So mine was 136 on 81 with a heart rate of 58 that time.
You know what? Mine's 117 over 76.
So yours is slightly higher.
Slightly higher, but pretty good. Now, what was my systolic last time? Was 117, I thought.
I thought it was, yeah, 117. Yeah.
Was it? We should have wrote those down.
And mine is much higher, which certainly the research has shown that typically the wrist cuffs estimate a higher blood pressure.
All right, so there you go. One of them came pretty accurate. One of them was a little off.
Yep.
The idea is you want to measure your blood pressure at least 3 times.
Yep.
Take an average to see what it is, and frequently throughout the day if you're really trying to monitor your blood pressure closely.
And what I'd say is the role for the wrist cuff. So say some people can't tolerate the upper arm cuff. It just simply hurts too much. Or if the size of your arm and the cuff don't match, that can be an issue. I would say the other thing is a matter of convenience. People like the size of a wrist cuff. It's probably a little bit cheaper. So it's worth it as long as you keep those measurements, bring them into your doctor, and then they can correlate with the measurement that they get in the office.
Yeah, I'm going to side with the cardiologist though. Just from an
Always.
engineering point of view, I'd go with the arm cuff. You're measuring off a bigger vessel.
Yep.
It's closer to the heart.
Yeah.
As Rush said.
That's right. There you go, closer to the heart. Okay, now you know. So leave your comments. If you like this video, please like it, subscribe to our channel.
And let us know your experiences with either an arm cuff or a wrist cuff for measuring your blood pressure at home.